G'day everyone. I just wanted to share some interesting surgeries that we did today with you. We've had Amy doing 3 dog castrates and a bitch spay, so desexing those 4 animals. And I had another dog castrate plus also a rabbit spay to do. And the interesting thing is sort of comparing what's happening inside the rabbit to the bitch, the rabbit uterus to the bitch's uterus. So if it doesn't put you off your food, have a closer look. These are the 2 uteruses. Now the rabbit was about 1/3 of the size of the bitch. It wasn't a very big bitch, but she was still about 6-month-old bitch. The rabbit was about 4 months old. This is actually the rabbit uterus, and this is the bitch uterus. So with dogs, they've got a small body to the uterus, which joins to the cervix and then to the vagina. The 2 horns are really quite long, and that's where the puppies sit sequentially as they develop. Up at this area, this is where the ovaries are, and this is the ovary that I've opened the little bag that surrounds it, and you can see it's just a little bean, not doing anything at all, just sitting there sort of nice and quiet. So immature bitch uterus, perfectly normal. Coming over to the rabbit, this is only a 4-month-old rabbit. Rabbits are interesting because they have two cervixes, sort of divided into 2 down here, which makes the surgery a little bit more interesting. Then they've got these 2 long horns for their kittens to sit in. And right up here is we've got the 2 ovaries. Now these ovaries are actually active. These black or dark spots are corpus lubricans. That's follicles that have ruptured, release their egg, and then changing into hormone-releasing little bodies. So this rabbit at 4 months would have been able to breed. So that's really quite interesting. So this compared to this, it's a huge difference in the size, and yet the rabbit was a lot smaller than the bitch. This uterus was probably on heat, and the lining of it is quite thickened because of that, getting ready for implantation of eggs. So the inside of the uterus is very soft, it's thickened. It's just a lovely little bed, if you can imagine the egg coming down to sort of stick on that and sort of embed in there for the fetus to develop. So there you go. So I thought that was really quite interesting, seeing the 2 of those. Hope you agree. Now I have got one other sample, and that is the eyeball of a rabbit. Some people find this pretty gross, so just look away now if you get a bit worried. So this is the right eye of a rabbit, and the reason why we had to deal with it is because of this little structure here. This poor young rabbit, you've seen the uterus, has been in quite a nasty fight with some other rabbits. She's got a mark across her eyeball here, across the cornea, which is hard to see, but I know that it's there. And then she had this sort of structure here. This is part of her iris, the coloured part of her eye. And what's happened is that the rabbit has been in a fight, something, a claw or a tooth, has penetrated into her eyeball, ruptured her eye, and because the eye is full of fluid, that fluid has been flowing out, and the billowing curtain of the iris has gone and plugged into that hole and been pushed, some of it's been pushed out, as you can see here. So luckily, really, the iris did plug the hole, or the eyeball would have collapsed completely. But this is a very difficult thing to treat. It'd be very difficult, because it was 2 or 3 days ago that it happened at least, to be able to fix that and get the eye to stay healthy. So unfortunately for this rabbit, we've removed her eye so that there won't be any post-op complications. If we tried to replace or cut that off and replace the rest of it and sew the cornea, then we could have still had major dramas and taken the eye out down the line at a much, much higher cost. So that's what's happening here. Now, if you still don't mind being grossed out, I'm just going to see if I can slice this open to see if we can see this iris. So here we go.
As you can see, eyeballs are actually quite tough. It takes quite a lot to actually cut into the cornea. So what popped out there, that is the lens. That's usually right at the back of the eye, but because of the rupture, that had been pushed forward as well. This is more fluid from the back of the eye. It's coming out. It's thicker at the back, watery at the front. And that is the piece of iris that's just floated down into the hole, leaving this, you can see the iris here. That's actually looks like it's stuck to the underside of the cornea all the way around. So even if we'd tried cutting the iris off, I don't think this eye would have been any good at all. So good decision to take it out. The dark colour is the lining at the back of the eye where the nerve cells will attach. So yeah, so there's a little bit of nasty looking material here. So there was probably some infection already starting in the eye. So again, another good reason that it was the right decision to take this eye out. So there you go. So that's the internal bits of an eye that's been quite damaged. It's not normal. Often the back of the eye in a rabbit will look quite red where the light reflects off it, but this is quite black, so there's been bleeding and bruising, and this looks like infection coming through here. The lens was prolapsed, the iris was stuck to the cornea, and there was a hole in the cornea with the iris coming out. So all in all, not a very happy eye. The rabbit, though, will be much, much happier. You take pain away from an animal and they will be happy. So might only have one eye, no pain means a happy animal though. Anyway, I hope you've enjoyed watching sort of more gruesome video, and we'll see you another time. Bye.